So after pharmacy school, what were the steps to become a critical care pharmacist?
So after pharmacy school, I did 2 years of residency. So kind of backtracking into pharmacy school. So I went to South University School of Pharmacy, now mainly solely located in Savannah, Georgia. So there was a campus in Columbia at the time. And that program was an accelerated program, or is an accelerated program. So it was a 3-year program. And so we went to school year round.
Yes.
It was great. But in that, you know, usually when I went into pharmacy school, I was like, I'm going to be a retail pharmacist. Because that's the only path that I knew at the time. So that was what I was going for. And then I made someone be my mentor, Dr. Marquita Winder. And she gave me the viewpoint of becoming a clinical pharmacist. So she was one of our professors, but she had an endocrine clinic at the VA, the local VA in Columbia. And so she put me on the path of what it takes to get into residency. So that's volunteering, having leadership roles in pharmacy school, good grades. I kind of cheated on that end. And then having really good clinical experiences as a student. And so she really helped me to kind of guide that. Doing research was a good big thing at the time too. And so Dr. Kendrick Ware, he helped me with a research project. And so from there, you do the application process. And so you do a 1st-year residency, which is just general practice pharmacy. So you get your hands into all of the clinical settings that are offered at the facility.
Yeah.
So, you know, like I wanted to do VA facilities because that's where my mentor was. And I also liked the independence that you can have as a pharmacist in the VA setting. Or the autonomy. So 1st-year residency was in Dublin, Georgia. And at Dublin VA, the real name is escaping me, but there it was a VA, and I did inpatient staffing, outpatient staffing, geriatrics, acute care, anti-coag, pretty much a gambit of training. And that was one of the toughest years I've ever had.
I bet.
Yeah. So, you know, you kind of try to figure out, you realize you're not as smart as you thought you were.
Mm-hmm.
And residency really shows you your areas of weakness or areas for improvement. And people really hone in on that. So it can definitely be a blow to your self-esteem, but it's all in the process of molding you and to be a better clinician. So 1st-year pharmacy residency there, and then I thought I was going to go into palliative care and pain management. No, did not happen. So that would be my 2nd year of residency, and in that year you specialize. And so I interviewed for pain palliative residency programs, and I also interviewed for ambulatory care programs. Try to, you know, keep it spicy, but
Okay.
I ended up, yeah. I ended up doing ambulatory care here at Cap and James A level. And so the 2nd year, you're solely practicing in that particular area that you are going to specialize in. And so a lot of ambulatory care, which is chronic disease state management with veterans, actually ended up doing pain management. And my facility is a federal facility. And so we see active duty military, we see retirees from the military, as well as veterans, because there's a difference, and different insurance. And then we also see dependents. So we see pediatrics, we see women. It's pretty much anyone from newborns to 105. Then that was my oldest patient, 105. And so, yeah, did my training there. And then they hired me on after that. I feel like I'm rambling. So do you have specific questions?
Nah, you're good. You're good.